I have prepared my medications and now I'm ready to enter the room and administer the medications to my client, Miss Florence Nightingale. Knock, knock. I've hesitated a minute before I come into the room, but Miss Nightingale did not respond, so I will walk in. Miss Nightingale, my name is Pat London, and I'm here to give you your medications for this morning. I check her name band, Miss Nightingale, and also over the bed we have her name, Miss Nightingale. For the purposes of this demonstration, I've already raised her bed to my working height, and I've elevated the head of her bed at least 30, 45 degrees to a full fowler's position when I give my medication. Always we will have the head elevated when we give oral medications. So, Ms. Nightingale, the first thing I'm going to do is check, do my third check on the medications to be sure I have them right. And I will again do this systematically. So I come to 8 o'clock, and my first medication is the optic drops, Demo-Dose optic drops, 1 drop, right eye, every day at 8 a.m. for Florence Nightingale, and the expiration date is 2020. My next medication is Cardi. I have Demo-Dose Cardi, 120 milligrams by mouth, 3 times a day at 8 a.m. for Florence Nightingale. My next medication is Aero Inhaler, Demo-Dose Aero Inhaler, 1 inhalation twice daily at 8 a.m. for Florence Nightingale. Expiration date is 2020. And my last medication is Digio, Demo-Dose Digio, 0.25 milligrams by mouth every day at 8 a.m. for Florence Nightingale. So, Ms. Nightingale, what we will do first is your Aero Inhaler. Have you done that before by yourself? And since she's not responding, I will do the Aero Inhaler for her. Before I do that, though, or even begin administration of her medications, after I do my third check, there's a couple things that I want to do. And I have an acronym that I use, and that's SSE. So I am going to look for any signs or symptoms that she might have of adverse reactions to her drugs. But I'm also looking for signs and symptoms of that this medication is working, that she's been taking. So what are the outcomes of this drug that she has? So I may ask her questions, so I have some subjective response, but I may also observe. The next thing I'm going to do is collect any special data that I need. And for the medications that I have here, I don't need to collect special data. But if I were giving a Coumadin, I would have already checked the PT-INR to see where Coumadin level is, or what her INR level is. If I'm giving an antihypertensive medication, I will check her blood pressure before I give it. If I'm given an antihypertensive or an eye drop like Timoptic, I might be checking her apical pulse. So we're looking at signs and symptoms and outcomes. We're collecting any special data, and then we're going to educate our client. And many times in our extended care facilities, our clients are well educated and they teach us about their drugs. But we never want to skip that step of education because it has 2 purposes to it. One is that we let the client know what we have. So, Ms. Nightingale, I have for you your puffer, which is what you call it. I have your eye drops, and I have your 2 medications that you usually take in the morning. I'm doing that for 2 reasons. One, to let her know what I'm giving her, and to educate her if she has a readiness for that education. But I'm also giving Ms. Nightingale a chance to tell me if something doesn't sound right to her about what I'm giving her. So if she says to me, ooh, I usually only get 1 pill in the morning, I'm going to go right back and check my MAR. But in this case, Ms. Nightingale has not expressed any opinion about these medications being wrong, so we'll go ahead and give her drugs. The first one I'm going to give her is her Aero inhaler, and I've chosen to give this first because that will help to open up her bronchioles, make it easier for her to swallow and easier for her to breathe. So I will shake this and hold this to her mouth, and I'm going to tell her first to take a very deep breath and blow out all the way. So Ms. Nightingale, once you have done that, deep breath, blow out all the way. I'm going to give you a puff, inhale deeply, and I'm going to help her hold her mouth shut, but which she would hopefully do herself, and have her hold that for 10 seconds, and I'll count for you, Ms. Nightingale. We're about to 8, 7, 6, 5, 4, 3, 2, 1, and now breathe out through pursed lips. Just like you're whistling, Miss Nightingale, and that will extend that expiration rate and help her to have that medication in longer for her to be able to absorb it. Because I've had this at her mouth, I'm going to take this apart. When I leave the room, I will wash it and allow it to air dry before it goes back into the cart. So next I will give her oral medications, and I like the idea of checking with Ms. Nightingale to see how she usually takes these. Does she take them one at a time? Does she take them on a spoon? Are they generally crushed for her, which of course we would need an order for. So because Ms. Nightingale has not expressed an opinion, I'm going to give her her oral tablet, and of course I would take this out of the foil wrapper. These are unit dose packs. Put it in her mouth, give her a sip of water. And once I have done that, I'm going to check in her mouth. Please lift up your tongue, Miss Nightingale, to be sure that she has swallowed that. Next is her second medication. So, Miss Nightingale, here you go. Here you go. Swallow. And I will check to be sure that she has swallowed that medication. Next I have eye drops, and if I have done any kind of handling, as I did with the Aero inhaler for her, I'm going to change my gloves at this point. And I'll sanitize my hands. And we'll use the 15-second rule, which we will compress the time a little bit because of our videotape. Now, the eye drops can be applied in a couple of ways, but the issue is that we want to have the head at a somewhat level angle so that the eye drop stays in. And as you can see, I have violated the principle of allowing that hand sanitizer to dry before I put my gloves on. So we have two options. One is to lower the bed for Miss Nightingale so that her head is flat in order to get the eye drop in. I'm going to double check which eye I'm putting this eye drop into, and this would be into the right eye, so that would be this eye. When I take the cap off my eye drop, I don't want to contaminate that. You can set it down like that or hold it in your hand. I'm going to pull down on the conjunctiva and put the one drop in. After I put the one drop in, I will move my hand over to the lacrimal duct and hold that for 1 to 2 minutes. If I am going to repeat this same eye drop in this same eye, I will wait 1 minute in between administration. If I have a different eye drop to administer, I'll wait 5 minutes, at least 5 minutes, but it could be longer. Should I need to administer a drop in the other eye also, I can still use this gloved hand, but I'm going to use a different finger to pull down and administer. And in this case, Ms. Nightingale, we just administered in her right eye. So, my next step is to be sure that Ms. Nightingale is comfortable, that she has her call light in place, the other standard steps that we do when we leave a client. And then I will sanitize my hands and do my 6th rite of medication administration, and that would be to document. In this system, we're documenting manually. So I've documented here, or will document here with my initials, and then I will come back to the front of this chart and document my initials itself, that I am the one that have these initials. And